Lung cancer is the world's most commonly diagnosed cancer and its leading cause of cancer death, responsible for more deaths than the next two most common types combined. It begins when cells in the lungs start growing beyond the body's normal control, and while smoking remains by far the strongest known risk factor, a link firmly established by the 1950s, it isn't the only one. Radon exposure, air pollution, and workplace chemical exposure all contribute as well. Symptoms like a persistent cough are often subtle enough to be dismissed early on, which is part of why lung cancer is frequently caught at a later stage. But treatment has changed enormously in the past 2 decades. Targeted therapies now allow doctors to match treatment directly to a tumor's specific genetic profile, rather than relying purely on general chemotherapy, and early stage detection dramatically improves outcomes. Low dose CT screening for people at especially high risk, such as longtime smokers, has also started catching more cases earlier, at a stage where treatment is far more likely to succeed. A genuinely significant shift from just a generation ago, when lung cancer was rarely caught until it had already advanced. It's worth saying plainly, too, lung cancer can and does affect people who have never smoked, so it's never solely a smoker's disease. Globally, lung cancer alone accounts for nearly 1 in 5 cancer deaths, which is part of why public health efforts against smoking, from warning labels to workplace smoking bans, are considered some of the most impactful cancer prevention measures ever implemented. Countries that reduced smoking rates decades ago are now seeing the corresponding drop in lung cancer cases play out in real time. Breast cancer is the most commonly diagnosed cancer in women worldwide, developing when cells in breast tissue grow beyond normal control. Risk factors include age, genetics, and family history, and it's often first noticed as a new lump or subtle change in the breast. Widespread mammography screening began in the 1960s and 70s, and since then, hormone and marker targeted therapies have transformed treatment for many patients. 5 year survival for early stage breast cancer now exceeds 90% in many countries, a genuinely remarkable improvement over just a few decades. One detail that surprises people: men can develop breast cancer too, though it's far less common. Genetic testing has also become a significant part of the modern picture. Inherited mutations in genes like BRCA1 and BRCA2 substantially raise lifetime risk, and identifying carriers early allows for more frequent screening or, in some cases, preventive measures, turning what used to be pure uncertainty into something patients and doctors can actually plan around together. Colorectal cancer deserves a specific mention because it may be one of the few cancers screening can catch before it ever technically becomes cancer at all. Most cases begin as a small, slow growing polyp on the inner lining of the colon or rectum, and when a colonoscopy, which became widely used starting in the 1970s, identifies that polyp early, it can simply be removed before it has any chance to progress further. In many countries, routine screening now typically begins around age 45, and that single recommendation, consistently followed, is credited with preventing a substantial share of what would otherwise become full blown cancer cases every single year. Risk factors include age, diet, and family history, and while colorectal cancer has traditionally been associated with older adults, rates among younger adults have been rising in recent years for reasons researchers are actively studying. Early stage survival rates for this cancer are genuinely among the highest of any cancer type, which makes routine screening one of the single most effective tools in all of oncology. Diet appears to play a real role too. Diets higher in fiber and lower in processed and red meat are consistently associated with lower risk in large population studies, though researchers are still working out exactly how much of that effect comes from diet directly versus other related lifestyle factors. Prostate cancer develops when cells in the prostate gland grow beyond normal control, and it has a somewhat unusual reputation among cancers. Many cases grow so slowly that they never end up causing serious harm at all, and a meaningful number of men diagnosed with it will eventually die of something else entirely unrelated to the cancer itself. The PSA blood test, widely used since the late 1980s, helped detect many more cases, but it also led to an important ongoing medical conversation about overtreatment. Since treatment carries real side effects, doctors and patients increasingly weigh watchful waiting as a legitimate option alongside surgery or radiation, rather than assuming aggressive treatment is always the right first move. 5 year survival for localized cases is among the highest of any cancer. This particular cancer is actually a useful case study in a broader idea in modern oncology that not every cancer diagnosis calls for the same urgency, and increasingly doctors think in terms of managing risk over a patient's remaining lifetime rather than treating every finding as an emergency requiring immediate intervention. Melanoma, the most dangerous form of skin cancer, begins when pigment-producing skin cells grow beyond normal control. Though it accounts for a smaller share of skin cancer cases overall compared to other, more common skin cancers, it's responsible for the large majority of skin cancer deaths, which is exactly why catching it early matters so much. Dermatologists formalized a simple checklist in the early 1980s, still taught today. The ABCDE rule, watching moles for asymmetry, irregular borders, uneven color, a diameter larger than a pencil eraser, and any evolving change over time. The biggest shift in melanoma treatment came in the 2000s when immunotherapy, training a patient's own immune system to recognize and attack cancer cells, transformed outcomes for advanced cases that previously had very few options. The scientists behind that breakthrough, James Allison and Tasuku Honjo, won the Nobel Prize in 2018 for identifying the specific molecular breaks that normally stop the immune system from attacking cancer cells, and for showing that releasing those breaks could let the body fight back on its own, an idea now applied well beyond melanoma across numerous other cancer types covered in this very video. Caught early, melanoma is one of the most treatable cancers there is, which makes sun protection and simply paying attention to your own skin two of the most genuinely powerful tools available. Rates of melanoma have risen in many countries over recent decades, a trend researchers largely attribute to increased recreational sun exposure and tanning bed use over the 20th century, which makes it one of the rarer cancers where a population's own behavior change, more sun protection, and fewer tanning beds could meaningfully bend the future trend line. Leukemia isn't a single disease, but a cancer of the blood-forming cells inside bone marrow, broadly split into acute forms that develop quickly and chronic forms that develop slowly, each behaving very differently. It often shows up as fatigue, easy bruising, or frequent infections, since it interferes with the body's normal production of healthy blood cells. One of oncology's most remarkable success stories happened here. In 2001, a drug called imatinib, sold as Gleevec, was approved specifically to target the exact genetic abnormality driving chronic myeloid leukemia, turning what had been a typically fatal diagnosis into a manageable, chronic condition for many patients. A level of precision medicine that was almost unheard of at the time. It's also worth correcting a common assumption. Leukemia isn't primarily a childhood disease, even though it's the most common cancer in children. The majority of leukemia cases overall actually occur in adults. That imatinib breakthrough in 2001 also became a template the rest of oncology has followed ever since. Rather than searching for one universal cure, researchers increasingly look for the specific genetic on switch driving a particular patient's cancer, then build a drug precisely shaped to block it.